This conference will now be recorded.
Perfect. Okay, as some of you are aware and have joined us in the past, this webinar series is all about innovation procurement for the healthcare sector. And what we want to do through this series is to introduce you to the principles and the benefits of innovation procurement. We want to introduce and describe the forward commitment procurement methodology. And in doing so, we will use a number of case studies. These are really good ways, so we've certainly found them to be really good ways to demonstrate the benefits and to help illustrate the theory that kind of lies behind the examples. This webinar in particular is looking at the preparation stage of the innovation procurement process and specifically focusing on stakeholder engagement. Engaging stakeholders and end users is a way that we believe certainly something we believe is critical in identifying a credible and outcome-based requirement. We will use a number of case studies and case examples through this webinar, but these will actually be presented by a number of different presenters. The programme for today, my colleague Gunnar Wiles will introduce stakeholder engagement to you, and we will follow that with some case examples from colleagues in Poland and Italy. Marcin and Simona are both members of the EcoQuip Plus consortium, and they were both members of the predecessor project, EcoQuip. They both have a great deal of experience in implementing innovation procurement projects and will demonstrate that through their case examples, which I hope you'll find very interesting today. We will have a short Q&A session afterwards, so as I say, if you have any questions, if you put those in the chat function and we can pick them up at the end. Without further ado, I will pass you over to my colleague Gunnar, who will take you through this introduction to stakeholder engagement in innovation procurement.
Thanks very much, Hayley, for your lovely introduction, and welcome everyone to our, I suppose, to the autumn series of webinars from EcoQuip Plus. And today, we're going to, as Hayley said, we're going to look at stakeholder engagement. I'm just going to give a short introduction, actually, because the stars of today's show are presenters of the case studies. So, for those of you who were here for the previous webinar, we looked at and introduced the forward commitment procurement method of innovation procurement. And we looked at highlighted the 3 different stages. And today, really, what we're doing is focusing in on the first stage, the preparation stage, and specifically looking at how we identify and consult stakeholders and why that's important as part of the innovation procurement process. So, stakeholders, they're really the people, I guess, who are affected or could impact the project. They're the sort of people we're talking about. And first of all, let's think about internal stakeholders, because there are many internal stakeholders who will be involved in and definitely affected by any procurement that takes place. For example, the people that are actually going to be the end users of whatever service or product is bought. And it's really useful to listen to stakeholders and bring them on board at an early stage of this process, which is common sense. But often when you feel like you're in a hurry and you've got to get busy and you've got to get on with your procurement process, you can often think that this is a stage that we can move through quite quickly. But actually, if you spend time listening to stakeholders and understanding their point of view, you'll find that they have exceptionally useful practical insights into the situation into which that procurement will operate and how goods and services may need to change because the future is changing around us. And also they'll understand, well, these are the really good things about the current solution, but actually it could be improved in this way. And then I think we can identify key stakeholders that would be appropriate to bring into the project management team or decision-making unit. And this brings cross-departmental teams together and helps break down departmental barriers. So why do we bother? with stakeholders and end users? Why don't we just get on with an innovation procurement? Well, what we're trying to do is create a firm foundation for innovation procurement. And it's really important that people feel that their opinions have been heard at the beginning of this process. And that helps you to identify any potential risks and also hear any objections so that they can be brought out into the open and talked about at the beginning of the innovation procurement process. Also, on many occasions, you're going to be introducing a new approach to procurement. Some people might not know that much about procurement or how procurement operates, and even less about this thing called innovation procurement. So actually involving them and reassuring them that this process will work and will actually improve things going forward is an important part of the stakeholder engagement process. Critically, of course, stakeholders know what's going on. They know their jobs and they know the organisation that they're working in. So they can help define accurately what it is that we actually need to buy, accurately identify the unmet needs and the requirements to make that innovation procurement really successful for the organisation. Also, this is a really important point, I think, is that if you involve people at the beginning of this process, that means that they've understood what's going on, they felt heard, and that helps them to accept innovation. That means doing something differently when that innovation comes through the procurement process, and they're then asked to be the people implementing. And talking to stakeholders, bringing them on board, listening to their concerns helps to build trust. And that's a really important foundation for an innovation procurement process. There are different ways of doing this. It can be a formal process or it can be an informal process. And you will have within your own organisations different cultures and different approaches that you may have consultation processes already in place that can be adapted for the innovation procurement process. Sometimes the most useful stakeholder engagements can just be walking around and talking to people. Or probably these days, actually getting on a Zoom call with them. Asking open questions, really getting to understand what's going on now, provoking people to think about how things could be better is really what you want to be doing in this process. What works with what we're doing? What are the problems with the current solution? There are going to be future challenges. What are they going to be? How are things going to change in the future and how might we need to adapt? And wouldn't it be good if was a process that we used at a hospital here in the UK, where we brought focus groups of nurses together and just asked them that question. Wouldn't it be good if? And it was amazing the things that they perceived could be improved with really simple changes to the procurement process and then the future engagement of the suppliers. But you may find when you're working with internal stakeholders that actually their awareness in innovation procurement is rather low. And so that's a bit of a challenge, and helping them to understand what innovation procurement is about and how it works is going to be part of that process. Sometimes people don't understand the role of procurement and how valuable it is as a strategic tool to improve the goods and services and the overall improve the performance of the organisation. And if we're actually trying to identify unmet needs and in outcome terms, so that's understanding what are the outcomes we're looking for rather than specifying the product, they won't be necessarily used to doing that. So that's an education process and really using stakeholder engagement to help them to think in terms of outcomes rather than particular solutions. This is probably a slightly strange thing to say, you think, but very often we don't need to mention innovation because innovation can raise concerns. It sounds a bit scary to people. And what we're often saying was, would you like the goods and services that you need when you need them at a price that reflects the value that this organisation puts on them. That's really what we're talking about. That's really we're aiming for in innovation procurement. And other problems that you might come across, I think it's just useful to be aware of these are the things you might find, is that if you're asking people what are the problems, they may feel there's an element of blame there. So they may say, well, actually, no, that we don't have any problems. We're all doing fine, thank you very much. And sometimes you need a degree of patience to help them and just sitting around listening to people and getting them to talk about their job so that they understand that it's actually a safe space. Because for some, consultation may be an unfamiliar process, and things that are unfamiliar can be a tiny bit worrying. Sometimes you might find it's difficult to get access to relevant stakeholders when they're really busy, for example. And some people may think, well, hang on, if you're bringing new technologies in, is this going to change my job? Could this mean me losing my job or having a less valuable job in the future? So these are really valid concerns, and just be aware that those may be thoughts that are going on with people. But overall, in my experience, it's usually welcomed and seen as a really positive process. And if it's the first time that you're engaging with internal stakeholders in this way, just take it a step at a time and listen, and you really will be surprised the things you'll find out, and it will really strengthen the innovation procurement process going forward, creating a really good foundation. As well as internal stakeholders, of course, there are also external stakeholders. And during the preparation stage, it's useful to start thinking about and getting ready for the next stages of the innovation procurement process. So the demand side stakeholders, these are the people who might have the same or similar needs in order for you can demonstrate to the market that there is a credible demand. Other people want this too, is really the message that you want to get across to the wider market. And a really good way of doing that and finding these other potential buyers is to reach out through peer and professional networks, through interest groups, etc. So, for example, here in the UK, we're looking at reducing the use of single-use plastics in theatres. So an obvious group of people to speak to would be people who are interested in sustainability in healthcare. And of course, another group of external stakeholders is the supply side. These may be the incumbent suppliers, the people that are already supplying goods and services in the area that you're thinking of working in, but also potential future suppliers. And part of the preparation stage is understanding who they are and understanding what the communication channels are, so that when we get to the next stage, market engagement, you're ready to go. So the end of the preparation stage, really, it's just about having a firm foundation. Internal stakeholders are on board and they understand what's going on. You understand who the external stakeholders are. You've got a really good sense of what the current situation is. And you've probably got a cross-departmental team in place with some key stakeholders on board. Critically, you've got an outcome-based requirement agreed, and the project is embedded in the organisation, that senior management are clearly backing the approach and the project. And time taken at this stage always pays dividends going forward. It will reduce the risks and objections at the later stage, and that is one of the reasons we want to get stakeholders on board early. But of course, although we've, sorry, I'm going to go back a slide. Although we've looked today at, we're looking today specifically at identifying and consulting stakeholders in the preparation stage, stakeholders are also involved all the way through this process. Okay, including internal stakeholders in the pro-innovation tendering process. And of course, your wider market, your peer networks, other hospitals, to create this wider market of potential buyers. So that's my very quick introduction and overview to stakeholder engagement in innovation procurement. And I'd like to now hand over to colleague Marci from Poland. He'll introduce himself. I'll stop sharing my screen. Oops. Go to the right bit.
So I assume I can start, right? Gaynor?
Sure, Marcin,
Okay.
yeah, go ahead.
Okay. Good afternoon, everybody. My name is Marcin Couch, and I work for, in this case, Sucha Beskidzka Hospital, but I usually work for different entities, being a consultant in a various projects. Today, I would like to talk to you about how we did things in Poland. Here you can see the picture of Poland, and I'll be talking about two hospitals and probably three projects if we still have time. So I'll be talking about a small hospital in Rawicz, which is in the west of Poland, and Sucha Beskidzka, which is in the south, that you can have clearly marked here. I'll start with giving you some probably more broad sense of engaging the stakeholders. I would say that probably, and again, I already mentioned that there's really quite a big difficulty of identification of the need. So, from my perspective, engaging people in that stage would be really helpful, and actually can bring some very strange and very nice results. So understanding what you really need is really key, and it's more difficult than people think. Though it may sound like I'm talking about I'm talking some nonsense here, but when you start thinking about what you really need, you can come up with very strange thoughts, and sometimes you could be wondering why don't you know actually what you need. Mistakes that are often made in this process is that sometimes people just want to purchase something that they've already been purchasing using the innovative procurement, but not changing anything, just calling something differently, or adding this word innovation to the process. They often confuse innovative procurement with innovative products. So they talk about something that they heard that exists, some new technologies, and they want to buy it no matter what. And for many people, innovative is something that is actually not essential. It's something that is fancy, something that is nice, that is flashy, but they don't need it, so why they would actually care? And the last but one here is unwillingness to spend some more time on working on it. And I think this is basically because people, or quite many people, are quite lazy. So they don't want to spend time on something that is, from their perspective, maybe not that essential. Some of them are risk averse, so they don't want to take any risk. They want just to keep going as they were always doing things. So making people believe that this is really worth to spend some more time on that is probably the key thing in engaging them and then having their commitment. So this common problem that we encountered, the need identification in the case of Rawicz, was that we were seeking for some really high-tech, cutting-edge solution. We were talking about technologies that somebody thought that exist, but we are not moving anywhere. And in the case of Sucha, we did a lot of things to understand what we need. And if you could look at the date, we started to think of it in December 2012. And we're doing different things. We're engaging people by just, having meetings with hospital management. We had some sort of workshops when we were discussing things with hospital staff. We actually set some sort of evaluation group, people who were going around hospital and, talking to others and trying to spot things that would be the areas for improvement. But we were not very successful. We went through the next to purchase list, trying to identify what could be actually the things to be purchased in this new, different way, innovative way. Not very successful. We went to the UK. We spent like almost a week in the UK, and we were not going anywhere. What happened in hospital in Ravage, we simply decided that, well, we have to do something. We cannot just, talk endlessly about, what is the need. So we just look at the list of things to purchase, and somebody said, well, we have to buy hospital uniforms, and we really have to buy them. It's not like that it's artificial, it's not fuzzy, it's not funny, it's not, no, it's not flashy. We really have to have them. On the other hand, somebody asked, no, okay, but these are hospital uniforms. So what innovation can be here? So we were buying them for ages. They are all the same. So what? And then somebody thought, like, no, maybe we'll just have a different angle and maybe we'll talk to people. And we actually asked the hospital personnel, mostly nurses, what is the uniform of your dreams? And it was the first time ever in this hospital that anyone asked anyone else what he or she wants. So this was some kind of a revolution that we did. We simply asked people, what do you like, what do you dislike about your uniforms? And people basically hated their uniforms. They spent 1/3 of a day in them. They wear them every day, and they were complaining. First of all, they never got what they were promised. So even if a supplier said, no, these are the very nice uniforms that are blah blah blah, they never got what they were told they would. Mending them was a nightmare because, especially for pockets, people simply usually stuck some objects in their pockets, like pens, pencil, whatever, and they just tear. So sewing the pockets happened very often. People, they think that the uniforms were ugly, that they were heavy. So basically, they were very unhappy. In case of Suha, sorry, I'll go back. So in the case of Ravich, we simply knew that we had to do them, and we simply wrote down what people were telling us, what they think about the uniforms, what they like, what they dislike, and we turned it into an advert, and I'll show this advert just in a moment. In the case of Soha, as I said, we had problems. We were dealing with talking, discussing, and not getting anywhere. But luckily, there was a synergy of two projects. At the same time, we were running two projects, which was EcoQuip that was mentioned, and RES Hospital. RES Hospital was about renewable energy. And during this RES Hospital project, we launched workshops. And there were workshops that were basically related to renewable energy, or basically energy efficiency. But one of the groups that are working spotted something that we turned into this unmet need. Somebody just thought that, people are very unhappy in hospital and uncomfortable because there's too much sunlight. And actually, there was a decree in more or less the same time by the Minister of Health, who said, that patients should be somehow protected from this excessive sunlight. So in early July 2013, so as you can see, for like 7-8 months, we're trying to understand what we want. For 7-8 months, we didn't know what it was. But we turned this idea from these RES Hospital workshops into our unmet need, which in our case was improvement of thermal comfort of patients and personnel, with the lowest cost, hopefully zero patient cost. We understood that that's something that we want to purchase. What was the reason for that? As you know, the climate is changing, and especially buildings that are facing south are very vulnerable to these high temperatures. If you do not have air conditioning, you can suffer from very high temperatures. As you can see here, when the outside temperature was, let's say, moderate, 26 degrees Celsius, on a blind that were installed in the hospital patient's room, the temperature was almost 40 degrees. So you could start boiling eggs, actually. You can start prepared to boiling eggs. When we calculated, if we wanted to introduce air conditioning in these overlit rooms, it would cost us some 23,000 euros, and nobody has money for that. Our National Health Fund that purchases health services doesn't have any extra money for air conditionings. So we had to have some other idea how to deal with that. And I told you about this almost 40 degrees when we made some measurements. Actually, in 2015, in August, the temperatures on the blinds was 48 degrees Celsius. So it was really, really hot. This is our specifications from Ravich. I made a screenshot from what we did, and it was an announcement saying that we are trying we participate in the LCB healthcare projects. want to purchase something. This is hospitals, uniforms, and that was description what we would like them to be. And in the case of Sucha, I don't have a special screen for that, but that's how we phrase it in the leaflet that was disseminated among potential suppliers. So we said that we have a need of a solution that reduces the sunlight, that provides thermal comfort, that is energetically self-sufficient, etc., etc. So that's what we wanted to purchase. In case of Ravitch, we purchased uniforms that you can see here. They were tested, and I think it was a very good thing to do when you ever have a possibility to just test the solution before you buy it. There's a cotton one, and there are two ones that we finally bought. They are made from the very special fiber, which is somehow polyester, but also the natural one. So it's a kind of a mix of that. Actually, that was made from the eucalyptus tree fiber. So it's like, let's say, a bit ecological, a bit non-ecological, but people love that. They were really something to be liked. People felt very comfortable. They looked much nicer. They looked that they are more durable. So actually, after this testing period, some of the nurses were going to the hospital CEO and were telling them, these uniforms have to win. I don't care, you have to buy them because we like them. Luckily, they won the competition, but that was the attitude. For the first time, the nurses loved their uniforms. And here are some calculations. I'm not going to get through it into detail, but just to show you the differences in cost of so-called traditional uniforms versus this innovative from this eucalyptus fiber tree. You can see that all in all, they maybe cost more, but if you add all operation costs, it turned out we can save up almost 20%. And I would guess that the saving could be much higher because the uniforms were drying very quickly. So if your uniforms dry very quickly, you don't have to warm them for too long. So you can actually save on that. And they were much more durable than promised. So the producer promised that for 3 years they should be okay. But I remember that 2 years ago, in 2018, I was making similar presentation to the new audience, and I called back Ravitch Hospital and asked them, about the uniforms. And in 2018, they were still wearing them. Of course, they were very unhappy about wearing them at that time, but they lasted not for 3 years, but for 8 years. So they were really a good purchase. And in the case of Sucha, we got something that I'm going to show you in a moment, but we got a very different offers. So people were proposing that if you want to have a lower temperature in your rooms, you can use different technologies. You can see the price range was from 33,000 euros for the whole hospitals up to almost 800 euros. And that's the hospital CEO, Marek Haber, who is looking at the solution. So as you can see, he was quite happy about what we did. And what we did is that we purchased the marquises that are made photovoltaic material. So you can see here the pictures of the hospital being protected. If sun operates from very high, they are really very effective, so they don't allow sun to come in. In winter time, when the sun is much lower, the sun can enter the room and they don't have a problem of overheating. And here is the picture we took from the official opening when we're presenting the solution. We have some people from local newspapers, from other hospitals, the team who was working on that. So it was very successful actually. This was something that was later quite often disseminated in Europe to show how things could be done. If you look at the cost, you can see that the costs of the potential saving were quite substantial. So because we can not only protect, which was the main thing, to protect the patients from excessive light, we also can generate the electricity. And if you look at the picture of the whole hospitals, the southern facade is really big. So we can generate up to 14,000 euro per year, having extra electricity from the sun. If you compare it to the air conditioning, I mentioned that would be another option. You can see that the net value of this project, we are saving some 37,000 euro per year, which is also always nice to have. And now, last but not least, we are having this EcoQuip Plus project, and in this EcoQuip Plus project, based on the experience that we had so far, we decide to make a refurbishment of one of the wards, and we decided to ask the users again, as we talked to nurses in Sucha, in Ravitch hospitals, or listening the voices of people on these rest hospital workshops. We decided to talk to people. So we launched the questionnaire. You can see here the print screen from the survey. Then we asked them different questions like, what is that you're happy about? What do you think should be changed in this in our hospital? We also talked to other people. So we talked to MPPL, which is, let's say, the Polish Lancet. This is the medical portal that provides very, very good information and very quite high quality information. And since they are friends, and they thought it would be a good idea, so they disseminate information and ask their readers to participate in the survey. We talk also to our friends from Fundacja My Pacjenci, which is We the Patient Foundation. So through their channels, they also ask their contacts to take part in this exercise, and we got quite a number of respondents. All in all, more than 200 people responded to our survey. As you could see, patients and personnel more or less in same numbers. We also have visitors, and they provide us with the following information. So they believe that still the temperature and air quality is like the major issue. You can imagine what would be the complaints of people if we didn't do this installation some years before. Conditions patients room are also to be improved. The rest areas for patients and the equipment of the and quality of sanitary installation was also a bit questions. Other things are also to be improved, but as you can see, these are the 4 ones that we should focus on. So thanks to that, now we know that these are the areas that needs improvement, and when we will be launching the call, we know that we will have to talk to the potential suppliers about how to deal with the issues that are listed here. I think that's all for me. Thank you.
Thank you very much, Marcin. I love those case studies. Thanks very much. Simona, would you like to share your screen, and we'll move over to your presentation?
Yes, I will.
You can introduce yourself, yeah?
Yes. When I am introducing myself, I try to open my slides. And I am Simona Eiger, and I am the facilitator of the group of the Hospital of Bologna. And I have to describe to you our past experience, which has been sort of very, very difficult, I'd say, especially because it was the first. Can you hear me?
Yes, Simona, we can hear you very well.
Oh, good, good. Especially because we had to break the ground regarding the concept of innovation, and second, because we, as I will explain to you, we took the very difficult path of bringing innovation not to reach products but services. And I think that this was a sort of experience also for the people who were following us, especially and I think also for Gaynor, but especially for the agency. The project was part of an overall plan that has been launched in 2012, and the goal was to rationalize and improve the quality of the support services activities that were not strictly healthcare. And therefore it was dedicated to a huge amount of different people, patients and visitors, employees, students, because this is also a university student. And we were dealing, and we are dealing also now, with the Pavilion Hospital, made in a very large span of time, because the first buildings are of the 1500s and the last one is under construction now. So what we wanted to reach was to really realize a different system, an improved system of people experience. As you see, is a very large area, is the one marked in blue, in the middle of the city of Bologna, meaning is a sort of a downtown hospital.
Simona, can I just interrupt? We can't see your screen at the moment.
At the moment, you don't see me on the screen. How come?
We don't see your screen. We can see you, which is
Did
great.
you see? Did you see it before?
No.
At the beginning?
No. No, we thought
so
you were
from
just
the beginning,
so
I don't see.
You see at the bottom of the screen, the third button along says screen. You just need to click that.
I don't have any button at the moment. Let me try to find it.
Click your mouse, it will come up.
So share your screen. I'm pressing.
So
and
screen,
my entire screen.
And then you have to which bit of the screen, I think.
Maybe I have to take out my photo camera and hit the bottom of the slides.
Yeah, I think that would be helpful.
Okay, let me try. I think sharing the screen. I have the same problem I had this morning with the Hailey. Did you see something now?
No, still not.
Still not. Wow.
So you know where the microphone, the camera, and the screen icons are?
Yes. I'm pressing screen, but it doesn't seem to function. Even I have a full screen. Oh, let me see. Maybe now?
Yes, there we go. So then you just need to put your presentation there.
Okay.
Yeah, and then go on presentation mode.
Okay. So I can go on. I was here showing you the large area of the hospital, the different pavilions. You see them?
It is very clear, but could you put it onto presentation view on PowerPoint?
Yes, I have a PowerPoint.
Yeah, but you just put it on the presentation view, which is the third icon.
Sorry. I think that Simona is sharing the different screen, so she's sharing presentation, not the presentation mode.
Yeah. So if you put it into presentation mode, that should be okay.
No, yeah. Stop sharing and now share the presentation mode.
For me, you're speaking in Arabic.
Perhaps because we're going to run out of time, Simona. So I think what we'll do is that we will just provide you an opportunity.
Simona, I'm sorry. Greet hello to all of you. Simona, devi solo mettere visualizza presentazione. Solo quello devi fare, ma devi ricondividere il video come prima e poi fai visualizza presentazione perché era molto piccola, solo per quello.
Allora, io qui vedo incolla, righello, vedo tante robe, ma non vedo quello.
Il tastino della presentazione, vai sotto, fai visualizza, che ti guido io, fai visualizza schermo.
Non ce l'ho più, visualizza schermo qui. Aspetta, devo spegnere questo forse. Momento.
Condividi schermo.
Allora, io condividi schermo, ho solo scritto schermo. Sì, condividi schermo. Ecco qua.
Vai, vai.
Poi, adesso
Aspetta
ho il tuo intero schermo.
non lo vedo, però devi fare schermo, condividi,
Condividi, ce l'ho adesso, condividi.
Ok, vai, schiaccia condividi.
L'ho già schiacciato, adesso sono su condividi. Il tuo intero schermo?
Come
Simone,
prima.
Yeah, sorry.
that's okay, Simone. I think what we'll do is that we'll move on to we'll move on to questions.
Ecco. Ok.
Eh,
Torna sulla PowerPoint. Bene, no, quella di prima, presentazione aperta.
Presentazione aperta, devo trovarla. Ecco qua.
Perfetto. Ok, benissimo. Allora vai giù in fondo a destra, di fianco alle freccine.
Sì,
Ok, di fianco lì c'è un video.
sì.
Di fianco alla percentuale. A sinistra, vai a sinistra, lì. Vai.
Aspetta che adesso vedo. Presentazione.
Presentazione deve essere...
Presentazione, schiaccia su presentazione. Presentazione, no?
No, a
Ecco
destra,
qua.
lì, quello. Vai. Oh, fine.
Ci siamo. Meno
Vai.
male. Allora, this is the image of the kind of people that are into the hospital every day, and you will see. I have to rush. So they were 4 main projects. I'm very happy now both Marco and Daniela are here, and what is underlined in red is the one that we basically entered. It was a 3-year program going from 13 to the 15, and the objective was to save money, to improve quality, and to have a better ecological footprint and sustainability. So these were the legal basis for us. But what was more useful for our experience was this slide, which is one of the slides of Gaynor. And with regard to the identification, our basic milestones were in the consultation process. As you see, we immediately put the consultation with stakeholders. In the market engagement, we had also consultation with stakeholders, and finally also in the preparation, because as we were aware, the stakeholders were important in all the 3 parts of our process. So what happened at a certain point, and where, please correct me, Marco, if it's not so, we had the problem of finding out that the large project had much longer times of what we needed. And so, under the guide of Daniela and Marco, we turned into a pilot project. And in this passage, it was the one in which we had more help from the stakeholders, because they helped us to decide where to go with our pilot project. The pilot project was made in a pavilion where there was a renewal of a pending contract, exactly of the things that were represented also by the larger contract. So with the intense consultations and what is very important, we also used some stakeholders for having an accurate study of mostly nurses of the timesheets of every job activity. because one of the major problems in this case was to find the right combination between the work that was done by the outsourcing company and the inside work in the area of making the best place, the best of staying for the patients. So in all this process, we learned two lessons. First of all, the internal stakeholders are fundamental to support the decision-making processes in every phase and to contribute in the building up the belief and the interest for innovation. I like this very much, this small images, because for me, the willingness of innovate is very important, and is where the stakeholders, internal stakeholders, help us very much. The lesson number 2 was the external stakeholders that also are fundamental to prove the validity of an innovation vision necessary in every phase of the project. As Marcin was saying, there are so many obstacles that you have to meet inside, especially in a large hospital as the hospital of Bologna, the Sant'Orsola, but also in the external world, because in the external world, innovation is buy a new product. Is not the process that we are proposing, and especially there is a sort of, as Gaynor was saying, a sort of difficulty in convincing the production world. Now, very fast, what are we doing now? We have a team that is very, very similar to the other one, because again, we are going to try to find to improve the presence of the outpatient care, in the emergency care, etc. And I have to say that these are the areas that Daniela had pointed out to me as the areas of the major attention. But what happened? We have identified the major figures of DMU, and these are the categories that we followed. We have tried to also to start the process of the stakeholders, and this happened. We were one of the hospitals more affected by the coronavirus explosion, not because of the hospital, but because the region in which the hospital is, that is Emilia-Romagna, was one of the most hit by the virus, and the hospital of Bologna was, the Sant'Orsola was picked by the region as the coronavirus, one of the main coronavirus hubs. So it was like really the explosion of a bomb. Daniela was extremely involved, and she got even a touch of the coronavirus. Fortunately, not too serious as far as she showed to every one of us, and because she was one that had to provide continuously new emergency spaces, new special rooms for the coronavirus hidden people, and Marco on the other side, who had to run after all the administrative problems. Well, at the very end, what is my comment, my final personal comment, if you want? We have picked a subject that for sure has increased its importance after the coronavirus hit. But second, our project, I'm not sure in all the countries, but certainly in Spain, has a certain amount of money, I don't know how much, to be spent in the health system. So now is a crucial moment, is an important moment to diffuse the innovation, the new needs, the non-exposed needs, but the impact of the coronavirus has made them in many cases, even more relevant. And so I think I'm, and I hope I'm not the only one, but I'm very pleased, very interested in being inside of this project in this moment. So we are starting again our process, and soon I hope we will have nice new steps made to go in our process of innovation in Bologna.
Thank you very much, Simona, and thank you for your patience in staying with getting your screen to share.
No, excuse me. Now I learned a lesson, and so I'm very grateful to Marco and to all of you to have been patient with me.
Okay, so if you could, that's great. We'll now move on to the Q&A session. We've got a little bit of time. I'm aware that people may need to leave, which is absolutely fine, but I think we'll just, if it's okay with everyone, we'll just go over a little bit on time because we had some questions coming in. Martin, there's first of all a question for you. How easy was the engagement process, and what are the barriers and enablers of the stakeholder engagement process from your perspective?
I think it's pretty difficult in the beginning, and then it gets pretty easy. You have to build now enablers and barriers. You have to build credibility. So you have to let your people know, or other stakeholders know, that you mean it. So if you want to do something, it's not like, maybe we will do that, or I don't know. No, we will do that, and I need your help. So in the beginning, people are usually, a bit, maybe not today, or I don't know, I have other businesses, this is something new, somebody came up with another idea. So usually the beginnings are pretty difficult, but then when people realize that that they are being heard, and that what they say is somehow incorporated in the activity of the project, then they see, yes, that's actually, well, good, and they are more than happy to provide some more input. So the building the credibility and making it like a serious business, not just some kind of something that is okay, we have to do it, but I'm not actually very concerned about that. So be credible, and then things are going to be easier. But the beginnings will be always tough, at least from my experience. Thank you.
Thank you, Martin. Just following up on that, how important was the support you got from senior management and the messages that they were sending?
I think that was absolutely crucial. Without that, there's nothing you can do, or you'll be struggling about, everybody and everything. So if the CEO is not convinced, that you can just forget it. If he is on the board, then it will be tough but successful. So that's number one thing, is just to have, let's say, the key stakeholders. In our cases, it was always the CEO. And then if he said, like, okay, I really like it, I really want to have it, then you'll have results. For this purpose, I showed you the picture of Marek, who is looking at the result, and he's smiling, and he's very happy that we accomplished that, because from day one he was supporting that. So he saw also the result, and I think that it was absolutely crucial.
And I guess that makes it easier next time, because they're sort of thinking, great, let's do this again. That worked well.
Absolutely. Yeah, when I was trying to convince them, Słucha Beskidzka, to participate in EcoQuip, the initial one, they was like, okay, they knew me, they trusted me, so it was like, okay, but we don't know. when I came with EcoQuip Plus, they was like, okay, let's talk business. It was like immediately. We didn't have to waste time on explaining, understanding, learning each other for one another something. It was like, yeah, okay, let's do it. So it was really very. I really felt like, wow, this 4 years we spent on EcoQuip was not wasted. They really understood it, and they are happy to do that. And now it's very different kind of conversation I have with them when I come up with some processes and some projects to be done.
Thank you, Marcia, and it's really good to get such a positive endorsement of this process, and it's always great to see people repeating it, because it means, hey, they liked it, we'll do it again, it worked. Excellent. Okay, I just wanted to ask a question to colleagues from Bologna, and perhaps Marco, Daniela, Simona, whoever is appropriate. From my recollection of that project is that the stakeholder engagement process was absolutely critical, because there were key failings in the previous management that hadn't been identified, but were identified through the stakeholder process and through this very careful analysis of whose job was what and how much time they spent on it. But, obviously correct me if I'm wrong. And that must have been quite difficult as a process, and also for the people involved. And so knowing that you have recently moved through the pilot stage into the end, if you like, of what has been quite a long process, I just wanted to get a sense of how positive or what the response of the stakeholders has been to the solution now it's in place.
I all of you. Brief comments, because we have just answered in the chat. From the past experience, that the new contract is still implementing from 1 year, about 10 months but there are still litigation in the market from the administrative point of view, and so we hope that the future will be easier than now to be managed from the administrative point of view. For talking about the level of service and the new implementation, that is the result of the previous engagement at different levels of the stakeholders. We could say that is very positive, because end users, professional as well, seems to appreciate a lot the new level of services. Talking about the future and the new project that it arrives, that will be managed inside EcoQuip Plus. What we would take as a lesson for the market engagement, the stakeholder engagement, is that probably will be necessary to engage not only administrative references and direction, 1, 2 users inside the hospital, 3 probably companies that produce technologies to solve the unmet need, but 4th, that was the lacking point probably in the first project, the previous project, is the end users association. Probably we need patient inside the design process, and is the 4th level of stakeholder engagement that we would need to consider for the future.
Thank you, Marco. And I think that this is the way things have to go, isn't it? Is the greater patient engagement and involvement, and because actually the ultimate end user is, after all, the patient. Well, what I'm going to say is to close the webinar now, and I apologise that we've gone on slightly, and we've had a few technical issues, but thanks very much for everyone staying with us. And just a reminder, of course, to join us on the 1st of October for our next webinar on market engagement in innovation procurement. And all it remains is for me to say thank you very much to our speakers, and also for people attending and keeping with our webinar program, and look forward to seeing you next time. Bye-bye.
Thank you. Bye-bye.
Bye-bye. Thank you.
Bye. Hi, Hailey. Bye, Gaynor.
Bye-bye.